I wish we had sound to this a-hole, but we don't. He he went on Chris Hayes' program, and in some respects, I felt like the story didn't even get done justice. The Arkansas Times did a report, as you know, in Arkansas. It's one of the those states which was not going to pick up the Medicaid expansion. It ended up instituting a pilot program with a waiver from the Obama administration. I know, dictatorial powers, wherein they would have privatized basically the delivery of these Medicaid insurance. Apparently, about 100,000 people got health insurance that wouldn't otherwise get it. There is an attempt in the legislative body in Arkansas to reverse that. And apparently, what you need in Arkansas, that you need a 75% majority. Or I should say a 75% majority to maintain this legislation. I guess there's some attempt to repeal it, or it's just actually, I guess, just reapprove the funding for the Medicaid expansion. And you need a 75% supermajority to do it. So all you need is, I think, like 25 members in this 100-member House to prevent it. So you've got this Arkansas Representative Josh Miller, Republican, who was in a catastrophic car accident, I guess about 11 years ago, that broke his neck and left him paralyzed. He had no insurance. And we should say, apparently alcohol played a part in this, but he claimed at the time that he couldn't remember who was driving the vehicle. He and his buddy ended up in a ravine. It was pretty catastrophic. It's very possible. Josh Miller received his $1 million worth of treatment, even though he didn't have health insurance, through government programs, including Medicaid and Medicare. But apparently, according to Miller, and you should also know he also got disability and checks came in. His health costs were all covered by the federal government. He gets a personal daily personal care assistance through Medicaid, and he has gone on to become a state legislator and runs a rental property business. He apparently not only voted against the Medicaid expansion first off, but he is fighting against the reauthorization of this. And why? Because he said that some of the 100,000 people who have gained coverage through Arkansas's Medicaid expansion, this is according to the Arkansas Times, don't work hard enough or just want to access the program so they can purchase and abuse prescription drugs. My problem is two things, Miller said. One, we're giving it to able-bodied folks who can work. No word as to whether or not they could afford it. That's not relevant, I guess, according to him. And remember, he was able-bodied at the time when he didn't buy health insurance. And two, how do we pay for it? Now, every study that's been done on this says that it's going to save the state money. Of course, they don't have to pay anything for the next couple of years. Then they would pay 5% of the cost. But you would pay for that cost, but it would save the state money in other areas. Just contemplate the idea of a guy whose life was saved and not just simply saved, but enriched and enabled for him to become a state legislator, to run this business, because he does get personal care assistance paid for by Medicaid, who would deny other people the most basic level of health insurance. What goes on in that guy's head?
Do you remember
Honestly, it's just shocking and repugnant. The mentality that permeates through these Republicans. It's sick.
We were talking about how I forget his name, but the Ohio senator. I don't know why his name is escaping me.
Kirkland?
No, the guy whose son came out, so then he supported marriage equality. And we were kind of went on that whole Portman. That these guys need to have some type of personal experience of adversity. This is amazing. This guy's like, yeah, I absolutely did, and I'm going to go out of my way to make sure that people don't.
It's
a whole other level.
He was more justified in taking that money. He was more justified.
Oh, right.
It really is stunning.